I'm just gonna do it. Okay. Dun, 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 dun. Almost there. I'm almost ready. All right. Okay, so before we get started, most of you guys know me. My name's Casey Potetz. I'm an acupuncturist. I'm a clinical herbalist. I'm a master of science in oriental medicine. And I've created this presentation for you guys to help prevent and prepare for coronavirus should it infect you. And we can have a discussion at the end about all the different strategies that are available. So I want to start with the message that this is really important. You do not need anything to help protect you or heal you from coronavirus. Your body is perfectly capable of healing on its own. And everything that I'm presenting to you today is to help your body heal itself more optimally. This is not about acquiring things or, panic buying or anything like that. This is just presenting information for you. We're going to talk about food, we're going to talk about herbs, we're going to talk about Chinese herbs and Western herbs. We're going to talk about different strategies. And this is really to help you help yourself. All of this is for informational purposes and definitely not as direct medical advice. All this is so you can make your own decision on how to treat yourself and heal yourself. So some housekeeping things. If I break up or if anything sounds weird or if you need me to go back, go ahead and put it in the chat box for me. I'll be looking at that. Hi, Anita. Oh my God, I'm so excited all you guys are here. This is so cool. All right, and thank you for being here and for wanting to eat up this information and get healthy and well. So yes, thank you. Okay, and as you guys are coming in, I'm just gonna ask you to go ahead and mute yourselves. So let's see. It's a little tricky. Okay, device. All right. What else do I want to say right now? All right, we got the chat box down. Make sure you guys don't put, this is being recorded, so don't put any personal health data in the chat box. If you have personal questions, you can ask me after the class and I'll tell you how to do that. And then if you stay all the way to the end, I have some freebies for you guys. I have some awesome course materials that I put together to help you right now. And I have all of the resources. This took me a very long time. I have all of the resources for absolutely everything that I say, every claim that I make, I've backed up with resources. So I have some patients who are specifically fond of the resources I give them. So that is for you guys. And yeah, let's roll into it. Okay. See if I can actually move my slides. Okay. Okay, so here's my disclaimer. I'm gonna have to move some stuff around, hold on. Okay, so the products and information included in this presentation are not intended to replace professional medical attention or advice. Chinese herbal medicine treatment is to be integrated with Western medicine. Make sure you consult with your doctor before taking anything. If you're experiencing an emergency, especially difficulty breathing, call 911, seek medical attention. And then for chronic conditions, pregnancy or children, you want to consult with a medical doctor or a licensed herbalist before taking anything. So I'm not making any claims to cure or prevent coronavirus or any disease. And all the resources I just said are at the end of the presentation. Okay, so every time I give a presentation, I show a picture of my Serpu. This is my teacher, Dr. Lillian Changis Yang. She opened the World Medicine Institute in 1970, and she's from China. This is a graduate program for acupuncturists and herbalists, and I was lucky to be among her very last graduating class. So I always show a picture of her because she really represents the lineage of Chinese medicine and the long, long history of it. So she's the 64th lineage disciple So you can imagine how old this medicine is. And I'm so excited to share it with you guys. So that's a picture of me and my teacher. Okay, so let's get into this thing, this freaking coronavirus, right? Okay, so this is a picture. This is what this thing looks like. It's got these proteins that are attached to it, these little spiky things, and hence the name coronavirus because it resembles what a crown looks like. And how does it infect us? So it goes in through the upper orifices, the eyes, nose, and mouth, and it hangs out in the airways and in the sinus cavities before traveling down into the lung. So typically what we're seeing from most patients is a really bad cold. So these are the symptoms that we're seeing. These are the typical symptoms: fever, dry cough, sneezing, runny nose, sputum production, nasal congestion, shortness of breath, lethargy, muscle pain, headache, and dehydration. The cases that I've been following, the chief complaints have been high fever, and dehydration, and then muscle pain, which is probably due to the exhaustion of fluids. We're also seeing a lot of phlegm in the lungs, and that's where the sputum production, the nasal congestion, the shortness of breath is coming from all of that congestion in the chest. So that's kind of what we're going to be addressing as we talk about treatment strategies. As the disease progresses, it goes down into the airway and it attaches to the inside of the lung. This is where it starts to replicate. So okay, we have some more people joining us. Hi, hi. Okay, so what happens when it gets into the lungs is it starts damaging the lung tissue itself and also our lymphocytes, so our immune cells. So this is where the pneumonia phase comes in. This is the bulk of the infection, and this is really the worst of it. So what is happening? Why are so many people ending up in the ICU? Why are people dying from this? So a small percentage of people, I can't say that percentage because we don't know exactly, it looks like 15% or less of people have a peculiar reaction. It's called a cytokine storm, or it's referred to as a cytokine storm. And what that is, it's a hyperimmune response, almost like an autoimmune condition where the body, it releases or signals the immune system, but it's too much for the body to handle, and it's not actually taking care of the virus. The body starts to attack itself. So we're seeing a lot of airway obstruction. We're seeing swelling in the airways, swelling in the lungs, and again, we're seeing that really thick glue-like mucus obstructing the lung, creating a hardness around the lung. So the lung should be nice, soft, spongy tissue, and this mucus and this cytokine storm that it's creating is causing breathing problems. It's causing organ failure, and in the worst cases, it is causing fatalities. So, how do we treat this? In Chinese medicine theory, the best time to treat an upper respiratory infection or an external pathogen is in the very beginning stages. So this presentation is, the bulk of it is really about kicking out the pathogen early on, because that's going to give us the best chance of not having to progress further with further phases of the disease. All right, so when we back up, we look at global perspectives. You know, how is this thing going to end? How is it going to be over? There's really only one way, and that's when enough of us have the antibodies where the virus can no longer survive. There's no more viable hosts. So that's either going to be through a vaccine. Unfortunately, it looks like it's going to take about a year or a year and a half to get a vaccine. Hopefully, that's the process of that has been sped up, but more than likely and not ideally, it's going to be through herd immunity. Herd immunity is when enough people become infected by the virus and they fight it off or they recover from it effectively. That gives them the antibodies. When enough people have those antibodies, the virus can no longer, it has nowhere to go. It won't survive anymore. So what we can do to help is, you know, isolate, follow the Center for Disease Control guidelines. If you haven't been to their website yet, that's a must. Definitely need to go read about containing the disease. and using hygienic practices. And then the second thing we can do is fight off the disease effectively in order to get those antibodies. All right. So why use Chinese medicine? This is where I get excited. Okay, so Chinese medicine is so old. We don't even know how old it is, but let's just say it's 2,000 years old. Okay, it's a very long history. It's 2,000 years old at least. And since the beginning of this doctrine, they've been dealing with major disease pandemics. So over the course of 2,000 years, China has had more than 300 infectious disease pandemics. So they've gotten lots and lots of practice of using herbal medicine to treat this kind of thing. If you think about pharmaceutical medicine, which is only 200 years old, starting with the invention of penicillin, if we had that kind of track record, we would already have a vaccine. But we don't. Instead, we have all of this knowledge on herbal medicine. So I'm here presenting it to you guys so that we can use it for ourselves and our families and use it effectively in our modern epidemic. So for thousands of years, the Chinese have been developing herbal medicine for the treatment of infectious disease. All right. This is really cool. So CHM's Chinese herbal medicine has been used in conjunction with Western medicine to effectively treat more than 60,000 COVID-19 patients in China. And that was on March 24th. That's the day I wrote this slide. So by now, I know we're up to 91% of people in China have been effectively treated with Chinese medicine, herbal medicine. So we're probably maybe even double 60,000 people at this point. So this is amazing because we have the effective medicine. We have it, it exists. But because that's the Chinese way of treating, in America, what does that look like for us? So it does present a problem because Chinese herbal medicine will not likely be used clinically in the United States. We're not going to be sending Chinese herbalists into the ICU and distributing herbal medicine. It's still considered experimental here. So we have to figure out how to treat it the American way. The good news is that in Chinese medicine, all external pathogenic invasions can be effectively treated in the early stages. So this is before pneumonia phase, before the severe onset. It's actually, so I mentioned this earlier, it's most effective to kick it out in the very early phases. So that's what we're going to focus on here. So this is a picture of what Chinese medicine looks like in China. So this is like a tea packet with the medicine in it. And this is something that would be distributed to hospitals and homes. All right, so again, we're asking the question, what does that look like for us? How are we going to treat it at home ourselves? All right, so what's being prescribed and recommended for home care for people who are COVID positive? The World Health Organization isn't recommending anything, not recommending self-medication, not recommending antibiotics, anything for prevention or cure. So they're not even recommending hot water or vitamin C. And then the Center for Disease Control, they're doing a great job on hygiene and stopping the spread of coronavirus, but they're not giving us much information that's useful at home. So this means that they're leaving it up to the local healthcare practitioners. They're leaving it up to our internists to treat this on an individual basis. So this is the time where we really need leadership in the healthcare system. Okay. So I could go on microbiology or immunology or global perspectives for a while, but like I said before, I'm going to try to keep this to under an hour. And I'm just going to get to the meat of this. So how does Chinese medicine work? So Chinese medicine is different than Western medicine or Western herbalism because we're treating the root of the problem. We're trying to look past all of the signs and symptoms to get to the root cause of it. So we're always, I said this earlier, we're always looking to optimize the body's own natural healing process. not inhibiting it. So we're treating the person, not the symptom. And I'm going to tell you that because it can get a little bit confusing as we go through with the treatment strategies. Just always come back to this. Anytime you're confused about something, just remember we're treating the person's ability to heal. All right. Right treatment at the right time. Chinese medicine is all about administering the proper treatment when the proper symptoms occur. So when we're looking at coronavirus, we're looking at the 4 phases of disease progression. So I'm just going to go through them for you guys here. Prevention phase is when there's no signs of infection. This is really where we're just increasing balance and wellness. Early onset is also called influenza phase. And this is like very first signs. So that's like maybe like a little tickle in the throat, a headache that comes on. We're not really seeing like chest congestion, you're coughing yet. It's just kind of like, you know, when you first get sick and you're just like, oh, I have a terrible headache, and you think something is coming on, that is the time where you want to act. That's the most important time to act. That's early onset phase. Pneumonia phase is the full-blown lung infection. This is where we're seeing a lot of the chest congestion and the fibroblastic cysts that it's on the inside of the lung that's impeding the function of the lung. That's the worst of it. And then there's recovery phase. So what's happening is because the virus is so vicious, it's attacking lung cells and it's making it so there's long-term lung damage. So in recovery phase, we're looking more at clearing out all that excess mucus that's left over, and we have to replenish the body fluids, and we have to strengthen and tonify the patient. So let's get into it. Okay, so prevention phase. The signs and symptoms of prevention phase. So there's no signs of infection or illness. The patient might have a tendency to easily catch cold, or they might have digestive weakness. Digestive weakness is just a sign that could possibly mean there's an immunity deficiency. So the treatment principle here, so we want to strengthen the immune system. We want to strengthen the lung, of course, because that's the lung and the stomach, really, because the lung and the stomach are our first organs that get affected by an external pathogen. Right? And we want to increase wellness, and we want to balance any pre-existing conditions. So food medicine for prevention. So I have all this in some PDF downloads for you guys, so you don't have to worry about writing every single thing on this list down. And I'm also going to explain food medicine for prevention is really a general eating healthy guide. I'm assuming you guys already know how to eat healthy for your condition. If you're lost, you can contact me later. I can help you with that. But I'm just going to give you the rundown, and this way you can make sure you are hitting everything on the list so that you have a full spectrum of what a balanced nutritional plan looks like. So right now we want to bump up citrus fruits, vitamin C, of course. We want our whole grains in there because we want to get the full spectrum of nutrients and trace minerals. Dark leafy greens and beta carotene vegetables, that's like your bok choy and your carrots. Cruciferous vegetables, your broccoli and cauliflower. Poultry is in here specifically because of the B6 content. B6 is immunoactivator. Turmeric and garlic, other immunoactivators. Those can be very useful right now. Nuts, beans, and seeds are on here. This is part of a general macrobiotic diet plan. And this is going to help us, again, get all of the whole spectrum of nutrients that we need. Probiotics are in the food medicine category because traditionally we got our intestinal bacteria through kimchi and fermented sauerkraut. But these days we really just take probiotics as a supplement. Microalgae is on here, especially for those who do not eat animal protein, because we get that folic acid, we get that B6. You can also use seaweeds like wakame or kombu. And herbs and spices, so this is important. So I go with the 4 C's, cardamom, cinnamon, coriander, and clove, because they are very warming spices. They're really good for the digestive system. So I'm going to just explain something to you in Chinese medicine quickly. So When there's enough digestive fire, the body has enough energy to go elsewhere, such as the immune system or the lymphatic system. When there's not enough digestive fire, like when there's lots of cold in the digestive system in the stomach, all the body's energy has to go to the stomach and focus on that first. That's the body's first priority. So if we keep our digestive fire stoked, then we're going to have more energy overall to battle anything that comes our way. All right, so then foods to avoid. People really seem to like it when I give them custom nutrition plans, but they don't like it when I tell them to stop eating ice cream. But sorry, but this is not the time to be eating ice cream, and this is why. So the nature of the virus loves cold and it loves damp. So if you already have a cold and like phlegmy condition, that's the perfect environment that the virus is looking for. So we want to be eating a more balanced diet. We want to not be eating so many greasy foods or dairy or cold foods because that's just creating the environment that the virus is going to thrive in. Here's some pictures of some foods just to break up all the words. Okay. Herbal medicine for prevention. So there's two ways we can do this with herbs. We can balance pre-existing conditions. Remember, we're just talking about prevention phase right now. And then the second way is to use tonifying herbs. If you're not familiar, oh, I got a question. Okay, hold on, let me see if I can look at that. Oopsie. Okay, Karen, I can see like half of your question. I'm gonna answer it a little bit later. All right, so tonifying herbs. Tonify, if you're not familiar with the word tonifying, it means strengthen or nourish. And adaptogenic herbs are a category of herbs that have a specific function on the central nervous system to increase immunity. And we'll talk about that a little bit more later. Okay, so herbal medicine in the US, I mentioned earlier what it looks like when Chinese herbal medicine is distributed in China. What does it look like for us? So how do we make tea here, right? So we boil our tea bags, we boil water and we steep our tea bags in it, right? Tincture is an alcohol, it's herbs steeped in alcohol. And no, you don't take shots of it, you dilute it in hot water. The alcohol will evaporate and the herbal constituents are left over in the water, and it's taken internally. There are topical sprays, nasal sprays, and throat sprays. And then there are supplements and tea pills, and these are my favorite way to prescribe herbs because in the United States, we're really used to taking herbal supplements anyway in the form of tea pills or capsules. So you'll see throughout the presentation, I have 4 different patent tea pills, and they look like this, and this is what the pills themselves look like. Some of you guys on here are my patients already, and you're already taking these kinds of things. Why I like this brand particularly is because it's an American brand. They have great quality standards, and these are ancient remedies. These are thousands of years old, and they've patented them into these tea pills that can be safely consumed by the public. So that's why I really like them. It's easy to prescribe. Okay, let's talk about astragalus. Astragalus is probably the hottest herb right now. Okay, Carrie Ann, I see your question. So colors for organs, eating more for lung health. So yeah, actually lungs, I wouldn't say the colors, I would say for extra lung health, onions and pungent foods go to the lung. So we'll talk about that actually in the next phase. But yeah, onions, chives, pungent flavors are really good for the lung in prevention. Okay, so back to astragalus. Okay, so astragalus is really well known for initiating the Wei Qi. Wei Qi means defensive energy in Chinese. And there's all different kinds. You can take it in a tincture, you can take it as a pill. There's like a ginseng astragalus blend that I really love. But I would say Jade Screen is probably the most popular astragalus because it's a really nice blend. And again, this is a very, very old formula that somehow made it thousands of years into our hands right now. So it's pretty amazing. So it's used to tonify the lungs and the stomach and activate the Wei Qi. That's our defensive energy. They're using this specific formula in Wuhan to protect medical workers from contracting coronavirus. So yes, it's getting a lot of press right now. It's usually used seasonally. So this is used by people with allergies or people who have a tendency to catch colds. This isn't really for long-term use, but definitely while we're in the pandemic, I would recommend this to most people as long as they don't have an immunodeficiency or are taking immunosuppressants. So like I said before, we always want to check our medications before we take anything, and I can tell you how to do that at the end. I'm also going to tell you guys how to get all the things that I talk about here. Okay, the next one is probably, I don't know why, this is like my favorite category, is medicinal mushrooms. So medicinal mushrooms are so cool. They are adaptogenic herbs, and there's a lot of different ones. Just for example, reishi, cordyceps, turkey tail, chaga, and lion's mane. And the reason that we know they work is because they did a lot of studies on them because of their use for people who have been treated with radiation or chemotherapy. So medicinal mushrooms, such as these, were shown to increase the lymphocytes of patients who had undergone radiation or chemo. So that means it rebuilds the immune system, and it has a direct effect on the central nervous system for activating our immune response. So I have pictured something by Host Defense, and that's Paul Stamets. I really like his blend his brand because he does non-GMO organic mushrooms. There's a lot of different strains. I wouldn't say particularly that one is better for the other, but in the research I've done, which I've attached to all of the references, I would say turkey tail, cordyceps, and reishi are my favorites. Okay. And traditionally in Chinese medicine, this has been used for thousands of years, it's used for longevity. So let's just move on. Okay. How are we doing on time here? All right, we're doing pretty good. Additional tools for prevention. So remember, we always come back to the treatment principles. So we're strengthening the immune system, strengthening the lung, increasing balance and wellness. All right, and then immunoactivation. So vitamin C is really useful. Vitamin C is already water soluble, but liposomal vitamin C is particularly useful. I guess it's more readily available or bioavailable because it's fat soluble. Vitamins A and D, these are kind of basic. You guys are probably taking this stuff already. And ginseng, another adaptogen. Turmeric, a spice, and a really easy to use adaptogen. These are great things for prevention. Probiotics, we already talked about, and then sipping warm liquids every 20 minutes is recommended. And this is because, remember how I said the virus hangs out in the sinus cavities and the airways before it makes its way down to the lung? Sipping warm liquids can help wash the virus from the airway down into the stomach, when your stomach acid will kill it. So that's the reason for that. Okay, colloidal silver. Full disclosure, colloidal silver is not FDA approved to treat any condition, but I think it's really cool and I love it, and it's been used throughout history. It's like 4,000 years old, and so I'm going to talk about it. So colloidal silver, it just means it's silver that's suspended in liquid in water. It has a unique property or a unique way of being a broad spectrum antiviral, antibacterial, and antifungal. So I've provided sources for you guys both for and against the use of colloidal silver so you can make your own decision if you want to use it. What it does is it's able to bind to the proteins in certain virus, bacteria, and fungi, and actually kill the pathogen that way. So could it potentially bind to the proteins on the coronavirus? We don't know. We probably won't know for a really long time, but maybe it's worth a shot. So if you want to add this to your practice, you can do your own research. And they have throat sprays and they have nasal sprays, which I have recommended before to a friend of mine who is a nurse in the ER in Harlem. And this is really something that might be useful to use after a possible exposure. So you might want to keep it in your car, and then you can use it to wash away anything that might have come into your sinus cavities or mouth. Early onset phase. Okay, seawater, drink water. Okay. Early onset phase. So here are the signs and symptoms. We're seeing fatigue, muscle soreness, headache, chills, low-grade fever. There's no sweating here, or there's only sweating at night. There's aversion to cold and wind, and there might be a little bit discomfort in the throat. So this is not a full-blown infection, guys. This is really important. These are the very early stages. This is not, there's no congestion here. There's no chest congestion. There's no coughing. Very, very early stage. And like I said before, this is the best time to act. So the treatment principle here is going to be to release the exterior and expel the pathogen. And we're going to do that by causing a sweat. So the best way to cause a sweat is to use onions. So this answers Carrie Ann's question about foods for the lung. Foods for the lung are pungents. Everything in the onion family is going to be helpful right now. So we want to sweat out that sickness. We want to increase the body temperatures. They say the very best medicine for an early stage cold, flu, or viral respiratory infection is actually the white part, the bulbous part of the green onion. So you want to boil that and drink the broth. What I like to do for myself or my family members when they get sick, I just make a nice huge pot of onion broth, force them to drink it, and hopefully sweat it out overnight. But I need to grab a, okay. Oh, I'm echoing. Let me try to fix that. Thank you, guys. Is that any better? Still garbling? Better? Okay, cool. Thanks. Thank you, thank you. Okay, thank you for that. If you couldn't hear me for some reason, I was saying that the white bulbous part of the green onion is the empirical herb in the Chinese Materia Medica for kicking out a pathogen, for killing a pathogen early onset. So that's why we want to make this broth. So all the onions, green onion, chive, scallion, garlic, and ginger. All right, we also want to add our microbial herbs. So that's going to be your kitchen herbs like basil, oregano, thyme, rosemary. There's a lot more in that list that I haven't included. And then also bell peppers have a lot of zinc in them. So there's a trick to eat a whole red bell pepper in the morning, raw, when you first wake up, because that's when your immune system is waking up. It's the best time to take zinc. And chilies also have the same properties. And then you can use celery, cruciferous vegetables, and dark leafy greens as well. So I have PDFs with all of the grocery lists in them for you, so you don't have to worry about writing all that down. Okay, so what we want to do in the early onset phase is cover yourself up like this guy, except put socks on. And we want to drink our onion broth, drink our tea, and cause a sweat. Ingestible essential oils as rosemary, Be efficient substitute for fresh herbs. I would say that's a good question, SL. I would say no, because I've heard, there's lots of conflicting information about the safety of ingesting essential oils, but even so, I always believe that the whole plant medicine is better than any extractions. But I do believe that they could be beneficial still. So yes. Herbal remedies for early onset. Okay, I'm going to talk about these 3 E's. These are like the flagship herbs in Western medicine. We love these herbs. Rosemary can spike blood pressure. Trying to like move my chat box. It's not working. All right, I'm going to get to it later. So, okay. Western herbs, elderberry, elderflower, and echinacea, they're really useful. I'm going to tell you how to use them and how they're being overused. So first of all, they're being overused because people are using these as preventative medicines, but you don't need to be taking antivirals if you don't have a viral infection. So we only want to use these once we have that tickly throat, maybe some sneezing, headache, fever, muscle pain, stuff like that. Elderberry is found in syrups because it's, the juice of the berry that is medicinal, and it's really good for clearing toxic heat, strongly antibacterial, antiviral. Elderflower can be taken as a tea. That's a little bit more mild than the berry. It's also used for skin infections. And then echinacea is probably one of the most well-researched herbs for immunity. It's an immunoactivator, a really great herb to take in the early onset phase. Oh, side note too, elderflower is known to help prevent or get rid of mucus production in the chest. So this might be a good herb to use in the later phases of the disease. Deanna, thank you for answering that question. Deanna is an amazing herbalist. She helped me with this presentation, so thanks, Deanna. Okay, cool. Go. Okay, cinnamon is gonna help you induce a sweat. It's gonna warm the body temperature. So naturally, when we get a cold, our temperature rises. So we wanna help that mechanism and kill the virus by increasing the temperature. So that's why cinnamon is here. Licorice is probably the most widely used herb in Chinese medicine, if not the world. Licorice root is extremely detoxifying. It's so detoxifying that they actually use it to treat drug overdose. So it's the root of this plant. Mary June, I saw you posted a picture harvesting this a couple months ago, and I loved it. It's so useful. People usually say when I tell them about licorice root, ew, I don't like licorice. I'm not talking about the candy. The licorice root is really nice when you put it in a tea blend. So advocate for that. And then dandelion root, I like this one. It cleans the blood, it supports the liver, it's going to help eliminate free radicals. And citrus peel, especially aged citrus peel, is great for transforming phlegm. So for that chest congestion that we're expecting, this can help transform the phlegm into substances that can be either expectorated or digested by the body. If you want to be really nifty, you can eat your tangerines and your oranges for preventative medicine, save the peels, dry them, store them, and use them for an acute respiratory infection. Honey is another expectorant. That's why that's on this list. And then vitamin C herbs would also be a good idea. So that's like rose hips, hibiscus, or even lemon juice. Foods to avoid. Okay, so as a review, we want to avoid damp and cold foods. So we want to avoid greasy foods. We want to avoid dairy right now. You're not going to be craving this stuff anyway. We want to avoid processed carbs and sugars. We want to avoid cold foods. Like I said, they're harmful to the digestive fire. We want to keep our digestive fire stoked. So we want to be avoiding cold drinks, raw foods, and fruits, which have cold energy, and fruit juices. A lot of people take orange juice when they're sick. I would say if you're one of these people, you might want to decrease the amount of orange juice you have because it has a lot of sugar, or switch to grapefruit juice if you are not on medications that interact with grapefruit, like benzodiazepines or insulin. Grapefruit juice actually is very alkalizing, and it works to take sugar out of the blood. So if you normally take orange juice when you're sick, you might want to switch to grapefruit juice, just a suggestion. And fruits, you can take fruits in small amounts, but you don't want to be like loading up on smoothies because they're high in sugar content and they're cold. So here is the big difference between foods for prevention and foods for early onset phase. This in early onset phase, we want to stop using all the tonifying herbs that we were using previously. And this is why. So in Chinese medicine theory, adaptogens like ginseng, turmeric, astragalus in the jade screen that we mentioned earlier, those are strengthening and nourishing. They don't pick sides when it comes to the fight between you and the virus. So there's a chance that it can tonify the viral infection. So that's why we stopped taking adaptogenic herbs on the first signs of a cold. All right, and same kind of idea behind this one. You're not going to be really craving these high fat, high protein foods either when you first get sick. You're going to be craving more pungent, crispy, aromatic things. American ginseng. Yes, American ginseng is good. Panax or Chinese ginseng is stronger. They have slightly different indications, but yes, American ginseng is an adaptogen that is well known for prevention phase, but not early onset phase. All right, so we want to avoid beef, pork, beans, and eggs. I'm not telling you you guys can't have these things. You can have them in small amounts if you're craving them, but again, these are tonifying herbs. They're, food medicine. So they're foods that are going to draw energy down into your body instead of expressing it and releasing it. So remember the treatment principle here. We're releasing the exterior. We're pushing out the pathogen. We want to be eating pungents and onions. Things are going to help us push everything out. When you take nourishing foods like meats and eggs or nuts even, those are drawing energy in. I hope that makes sense to you. I have 2 herbs in this category that are patent remedies. Again, these are very old patent formulas. They've been used for thousands of years and they're very, very useful. So here they are. The first one is Ganmao. This is, I always explain this as the first chess piece that you move. This is the first guy. So you're getting an external invasion. What do? You pull up the bridge. You tell your army to get into formation. And citrus peels and mushroom. Yes, I do. I'll share with you later. Danielle, thank you for that question. She said, do you suggest a food dehydrator, a method for citrus peels and mushrooms? And yeah, I'll answer that at the end. So Ganmao is it's the first chess piece. It's like telling your body to go on lockdown mode and to get ready to go to war. It's really well known. It's considered to be one of the most effective formulas for treating early stage pathogenic invasions. These are the 4 main herbs. Okay, and then I think I have a note on dosaging here. So you can take this for the first 3 days of a cold. It's the best time to take it. Not for long-term use though. Okay. Yin Chow, this is the second one. So Yin Chow, we take this one, this has antivirals in it. That makes it different from Ganmao. We use Yin Chow San when you start getting those heat signs. So we can see scratchy and sore throat. That's a heat sign. That's a sign that there's a viral infection. Aversion to wind, sudden fatigue, thirst. occasional sneezing, red, irritated eyes, there might be irritability or two, slight headache, mild body aches, and slight dry cough. So as you can see, we're getting a little bit worsening symptoms. We're going to use Yin Chao San. Yin Chao San, it has strong antivirals. They're going to help you expel the pathogen. And fun fact, this has honeysuckle, forsythia, and balloon flower. That beautiful yellow flower that kind of looks ridiculous is blooming everywhere right now in New England. That is forsythia. That's the medicine. I just think it's really beautiful about how the medicine appears when we need it. Okay, additional tools. So, of course, water and warm liquids when you're sick. It's a no-brainer. Vitamin C, zinc, A, and D. Posemon is a camphor and menthol-based massage oil. It's kind of like Vicks Vapor Rub. I love using this on my patients, and I have a bottle at home for myself for when I do get sick. It feels really good if you have like that upper trap and neck tension, muscle soreness. It also has a really nice pungent smell to it, so it can help clear the sinuses. All right, I'm just gonna like fix my chat box so I can see you guys. Okay, would you be taking jade screen while taking Yin Chao? SL, that's a good question. Okay, so the general answer is no, because we're using jade screen in prevention phase. And we're using Yin Chao after the pathogen has already started showing symptoms in the body. You can use it. Astragalus is kind of one of those herbs that some people think it's okay to use in early onset phase. But for the purpose of giving you guys information that is concrete and digestible, I would say use jade screen in prevention phase only, and use Yin Chao San only after the early onset symptoms have started to take their course. Okay, so thank you for that question. I hope it answers it. All right, so additional tools. All right, so I was talking about Posemon. That is a massage oil that's kind of like Vicks Vapor Rub. It's good for clearing the sinuses. It's good for muscle pain. And the cases that I've been following for coronavirus, so far it seems like muscle pain was one of the chief complaints. So this might be something that you want to have on hand. And then, of course, we want to warm the dantian, which is the center. It's like the lower abdomen. When we warm this area, the whole body goes into the parasympathetic state, that healing state. So you can use a hot water bottle, a hot pouch, or a heating pad. If you've never used a hot water bottle on your abdomen, you don't know what you're missing. A humidifier is useful, also useful for prevention phase, because it prevents the mucous membranes, particularly in the nose, from drying out and being susceptible to being infected or having the virus go up your nose. Humidifier is going to also prevent you from getting dehydrated, which is another one of the chief complaints that we're seeing from patients who have to deal with coronavirus at home. And then colloidal silver, again, not FDA approved and controversial. I don't see any harm in taking it for an acute respiratory infection. That's up to you to make a decision on. Do you have any? Okay, Mary, I'm going to answer your question later. Thank you for it. Throat lozenges, of course, we want to have these on hand. And then again, to address the dehydration, coconut water or electrolyte water. So you can get electrolytes in powder form. That's going to help you replenish. Okay, thank you guys so much for being here with me. This is awesome. We just made it through the bulk of the material. I'm going to kind of skim through the further progressions of the disease, because it's really important that if you're having severe symptoms, you seek medical emergency help. So how do we know when to seek medical attention? If you develop emergency, this is right from the CDC website. So if you develop emergency warning signs of COVID-19, seek medical attention immediately. So the warning signs are going to include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. So as you can see, these symptoms, these alarming symptoms, are indicative of a cytokine storm. We're seeing patients who have a really hard time breathing um, because because there's so much pneumonia and infection in the lung, plus there's a cytokine storm and their body is really attacking itself and closing the airways. So it ends up looking like somebody who's deprived of oxygen from being at high altitudes, or somebody who's even going into anaphylactic shock. So what else? And this list is not all inclusive, so please consult your medical provider. If you guys call emergency medical services, they'll ask you for your symptoms and they'll help you determine if you need immediate medical attention. Okay, pneumonia phase. So like I said, I'm not going to get too into this because this is a phase that should really be treated by a licensed professional, but I will give you some information so that you can treat it at home if you need to. So the signs and symptoms are fever, more pronounced in the afternoon, alternating chills and fever, cough, bitter taste in the mouth. We're seeing a lot of chest stuffiness, stifling sensation, chest depression, chest fullness, chest distension, irritability, nausea or vomiting. Let's see, weakness, and the treatment principle. Again, I'm not going to get too in-depth into Chinese medicine theory right now, but harmonize the Xiaoyang syndrome sort of means we're releasing it the exterior, we're treating those exterior symptoms, but we recognize that it's gone deeper into the body and we're attacking from within as well. Clearing the toxic heat, that's saying clearing the virus, and expelling the damp heat or damp cold, and that's all of that excess phlegm that we're seeing. So there are some great formulas, Chinese herbal formulas for this. They're only by prescription. You guys can't buy these online because just like antibiotics, they have to be supervised by a professional. So if you do want a stronger formula, I'll tell you how to get them at the end. But just for your information, this is a lot like Yin Chao San, except it's just stronger. It has more antiviral herbs in it, and it's specifically used, it's called Clear Fire and Scour Phlegm. So it's specifically used as an antiviral, plus it has herbs in it that help us manage all that extra phlegm and mucus. All right, and then lastly we have recovery phase. So this is after the infection has cleared, after there's no infection, there's no more infection, there's no more virus. We're left over with these symptoms. So there's absence of fever, dry cough, chest depression, shortness of breath, dry mouth, and weakness. So what we have to do is tonify the qi, I mean strengthen the body's energy. Nourish the yin loosely translates to replenishing body fluids, restoring the fluids. Tonifying the lung and opening the collaterals. We need to open the lung so that we can expel all the excess phlegm. So I wanted to include this Chinese herbal formula because it's really useful. It's based on pomelo peel. Aged pomelo peel also has tangerine peel and some other citrus peels. I mentioned to you guys earlier how citrus peel is really good for transforming phlegm. Also how honey is an expectorant. But yeah, this treats chronic productive cough. So is this useful like if you've ever had bronchitis or a respiratory infection and like weeks or even months later you're still left over with that congestion? This is really helpful to help purge the lungs. Okay, and it says for congestion that's worse when lying down. So that's just indicative that it's a phlegm sort of congestion, not for dry cough. Okay. How you guys doing so far? Are you still with me? Still have a lot of people in the class. Thank you so much for being here. This is so cool. I just have a couple more slides for you. I wanted to touch on over-the-counter medicines because I think they're widely misused and they can be very useful when used appropriately. So I'm going to start with NSAIDs, so non-steroidal anti-inflammatory drugs. This is your acetaminophen, aspirin, ibuprofen, it's like your Tylenol and Aleve. So if we back up and think about why we use these herbs, a lot of people grab these just because they have a low-grade fever. They say, oh, I'm getting a cold, I'm gonna take some aspirin, hopefully my cold will go away. But really, that's not how this should be working. You're inhibiting your body's natural defense system when you're reducing a fever. So a low-grade fever is healthy for the immune system. It's raising your body temperature so that it can zap the virus away. So you actually want to help the body heat up instead of cool it down with anti-inflammatories. I think anti-inflammatories are useful for high fevers and when there's lots of pain present. So when there's lots of pain present, if you're having a headache, you can stick your feet in hot water or use a hot pouch, put a bag of peas on your head. That's probably going to help bring down a headache quicker. You can also use an anti-inflammatory like these. However, we want to make sure we're not overusing them because, like I just said, we want to keep the body hot. And ibuprofen, the FDA says right now, they made a statement that there's no links to ibuprofen exacerbating or worsening the symptoms of coronavirus, but there has been studies that have alleged to this. So I would say for coronavirus, I would not use ibuprofen or Aleve at all. I would make sure you have Tylenol in your house or aspirin instead. Okay, so I hope that clears some things up for you guys. And then cough suppressants. So again, we're looking at why do we want to suppress a cough? A lot of people, when they get sick, they pop out the Robitussin or whatever, Dayquil, NyQuil, and they take that hoping that it's going to just get rid of their cough and they won't get sick. Taking a cough suppressant is like pressing pause. It's temporarily going to relieve symptoms, but it's also, like I said before, lots of chest congestion here. Coughing is helping you expectorate that congestion. Do you really want to inhibit your body's ability to cough? That's the question you want to ask yourself before taking a cough suppressant. A good indication for using a cough suppressant is if you are in pain, if your throat hurts so bad that you can't, get comfortable, or if you can't sleep. Decongestants. Decongestants are very useful for sinus infections, for ear infections. What they do is they constrict the mucous membranes temporarily, and it can help relieve severe symptoms like a frontal headache, sinus pain, or ear infection. So I would use this for acute pain. Just keep in mind when you use a decongestant, it's only temporary. There's something called rebound congestion that happens afterwards, and the pain and the symptoms are just going to come back. So just keep that in mind as we're using decongestants. And the last one I want to talk about is expectorants. Expectorants, I think they're actually really good and handy to keep on hand, like Mucinex. The last herbal formula, Qiguanyan, is kind of like a natural Mucinex. You can make that association. But just keep in mind that expectorants don't clear the infection. They don't have any effect on the infection itself. So this is going to be something that you're probably going to want to use in the later phases, maybe in the end of the pneumonia phase or the recovery phase. Okay, herbal safety. All right, we're getting through this, you guys. And I love the discussion that's going on over here about herbal medicine. Thank you guys. Okay. So don't order herbs directly from China ever, unless you're into heavy metals and sawdust. We always want to make sure we go through a manufacturer that is GMP certified. That stands for Good Manufacturing Procedures. All of the herbs I prescribe and sell have this label. If you're not sure, you have to go check it out with the manufacturer. Yeah, unfortunately, heavy metals are a thing, so we always want to make sure we use a company that has high quality standard tests procedures. Always follow the dosage and packaging or as prescribed. Don't underestimate the power of herbs. They are very powerful. I'm an herbalist. I've studied herbals for a long time. I've overdosed on herbs myself accidentally before. So don't underestimate the power of herbs, really. And we don't want to take anything that might interact with our medications or our pre-existing conditions. So if you're not sure, you can talk to a licensed herbalist or a doctor. I'll tell you how to do that after. Okay, so we made it through the bulk of it, so let's just review. So we talked about the nature of the virus, how it enters, how it goes into the lung, how it replicates, how it causes pneumonia, and how in a small percentage of people it creates a cytokine storm. That's that hyperactive immune response that is unfortunately ending up being deadly in a lot of people. So if you guys missed the beginning, I was saying that my purpose for this is to help you treat it early onset. Um, I am even confident in making the statement that in China, again, I have resources for this. In China, people who have taken herbal medicine for coronavirus specifically were much less likely to progress into the further stages of the disease. So it stopped the disease in its tracks. It stops it from bringing you into severe pneumonia phases, and hopefully, potentially, we can even say that it stops you from getting into a cytokine storm. So how do we treat it? We talked about prevention phase. We talked about food medicine to stay balanced. We talked about adaptogenic herbs. We talked about useful things like colloidal silver and astragalus. And then in the early onset phase, we talked about how we want to heat the body and promote a sweat. We talked about pungents and how to do that. Any opinions about hydroquinone? Okay, so Amita, thank you for this question. So she asked me about Western herbs, and I'm not going to touch on it in this presentation because I want to keep it. Okay, so we hit an hour, so I'm sorry we went over. I want to keep it short, but maybe I'll write you guys a little blurb in the email I send you with your freebies. Okay, sorry. So back to early onset phase. All right, so we learned how to use Ganmao Ling and Yin Chao San. We learned about echinacea, elderberry, elderflower, and then the strategies we can use to heat the body up and take care of ourselves during the early onset phase. And then I did touch on pneumonia phase, so you guys know that there are stronger antiviral herbs available to you if you want to get them. And then we talked about recovery phase and different strategies for expelling the phlegm. All right, so how to get herbs and supplements. So I actually created an online store specifically for this presentation because I want you guys to have access to that. So a lot of these herbs are in the online store, and you know, these herbs are really inexpensive anyway, and I dropped the prices to make them lower than what you would find on Amazon. So I'll send you the link to my store. You can get everything there. If you can't get it there, I have links for you guys too. Phone orders are the only way that you can get those stronger antivirals for pneumonia phase, so I'll tell you how to do that in a second. A lot of the stuff we talked about you can get at the grocery store, and then of course you can get stuff on Amazon. Get anything on Amazon. All right, so I promised you guys some freebies when you made it to the end. So the freebies are all right, so I have 2 grocery lists I made you guys. One is for prevention phase, and the other one is for the early onset phase. So you can use those and make sure your house is stocked with the things you will need. Okay, and then I've also made a PDF with all of the links for the things that I mentioned, things that I like to use for myself when I'm sick. I hope that you guys find that helpful. And then lastly, this is the juicy one. So I'm offering all you guys a 15-minute consultation with me. And this is there's a number of reasons I want you to cash in on this. It's totally free. I just want to spend 15 minutes on the phone with you because if you're interested in taking meds, if you're interested in taking herbs, I can check your medications for you. So that's important. If you want to talk about pre-existing conditions or your individual plan for prevention and treatment, we can discuss that. It's really good to establish a relationship with a licensed acupuncturist and herbalist. I would love to follow your case. If you do get coronavirus, I would love to be there for you. So these are all reasons I would love to connect with you on the phone. Okay, and then I'm going to tell you about my other offerings. I'm an acupuncturist. That's my jam. That's the bulk of what I do. So when this is all over, I hope a lot of you guys come see me. A lot of you guys are my patients already. I can't wait to see you again. I miss you. I miss giving you treatments. So yeah, come and see me when we're free from this. Virtual health consulting. I'm offering longer health consultations. They're an hour, and this is where we can address more in-depth pre-existing conditions. So if you guys are having problems sleeping or with digestion or stress, anxiety, any stuff like that, I would love to help you with that. So I'm offering virtual health consulting from the privacy of my living room. And then I also have a 9-month program. This is something I've been offering for a while, and I opened enrollment to it. This is really for people with complex conditions like fibromyalgia or autoimmune conditions. And in this long-term program, we help transition the patient into a life that is symptom-free. So I have that available too. So thank you guys so much for being here. I hope you guys got some value from this and you feel like it was an hour well spent.